Ozempic is a drug normally used to treat symptoms for diabetes patients, but it has also been used recently as a popular weight loss tool. But doctors have discovered some possible unforeseen complications, including serious gastrointestinal side effects like paralysis of the stomach. Dr. Tom Elliott, the medical director at the BC Diabetes, is joining us now with more. Dr. Elliott, thanks so much for being with us. I was reading over some of the accounts from patients who have been using this drug and similar ones for weight loss. What kind of symptoms are people experiencing?
Good morning, Sonia. The commonest symptom or side effect from Ozempic or drugs in the same class, they're called GLP-1 agonists, is nausea, is an upset stomach, and that can get worse and it can cause vomiting. It's not really a side effect, it's a direct effect, is that the stomach empties more slowly than normal. So, when people talk about paralysis of the stomach, it's kind of an overstatement. We know that if you take Ozempic, for instance, is a once-a-week drug. So for the week after the shot, your stomach's going to empty slower. It's about 30 to 40% slower than usual. So people, the effect of that is that people feel full for longer. So that's actually how the drug works. It works centrally by reducing appetite, and it works on the stomach by delaying the emptying of it.
All right.
And incidentally, it works to lower sugar by increasing the release of the patient's own.
All right. And so for some people, it has become unbearable. They're experiencing really frequent vomiting even after they stop taking Ozempic. What are the long-term implications here, or do we just not know?
Well, Sonia, fortunately, I don't think there are any long-term implications. I've prescribed these drugs in thousands of patients, and after a week, any adverse symptoms or side effects will go away. So I think your viewers and listeners can relax. But it's important to know that these drugs are not without side effects. So I quote my own patients a 10% risk of nausea such that they cannot continue on the drug.
All right. So do you notice a difference in side effects for people that are taking the drug for its intended use to treat diabetes compared to those who are using it just for weight loss?
No, it's the same. So the 10% figure is going to be true for people without diabetes as well.
All right. So do you have concerns about people continuing to use it for weight loss purposes?
Well, I mean, I would prefer that people lose weight by eating less and exercising more, so-called lifestyle approach, and not eating when they're sad, tired, lonely, or bored, or anxious. But the fact is that Ozempic and drugs like it are on the market and they're very effective. There is no threat of shortage, so if people can afford it, I'm happy to prescribe it with those caveats that they don't forget about the lifestyle, and that they know that once they stop the drug, they're going to go back to their original weight unless they can modify their eating and exercise habits. All
right. Now, I understand that you said that some of those symptoms or side effects like vomiting could subside after you stop taking it. But we are reading several accounts from patients south of the border that are saying they've been off of it for a year and they're still having those adverse effects. So, I mean, have you heard this? Do you know of, or are these one-off cases? How would you characterize that?
Well, when I was contacted about the interview, of course, I went online just like everybody does. And I was careful to find published scientific peer-reviewed literature. And I did not see evidence of prolonged side effects after stopping this drug. So my take on it would be that these reports we're hearing are in people who've got other unrelated gastrointestinal problems. So I'm not worried about long-term side effects from these drugs after the patient has stopped them.
All right. Well, thank you very much for your insight on this topic, and have a great day.
Thank you. My pleasure.